if not the lead story on all the major broadcasts was Magic Johnson disclosing his HIV status. And the ways in which the commentators spoke about this and framed it, at least as I remember, was very much kind of through the prism of courage. Oh, it took so much courage for him to do this. Wow, how brave he is. What a hero to talk about this at this moment in time. And I remember thinking, like, why does something about your health require bravery?
Yeah.
Like, why is courage necessary if you're just talking about
the stigma, right?
something about your health? And so that got me really interested.
This is Dr. Chethan Sathya. Thank you for tuning in for this episode of Northwell Health's 20-Minute Health Talk. Today, we are honored to be joined by Dr. Chelsea Clinton, a public health leader, vice chair of the Clinton Foundation, author, and podcaster. Chelsea, thank you so much for being here with us today.
Oh, well, Chethan, I hope you were going to say, and my friend.
And my friend,
and
yes.
Yes, I'm very happy to be here with you today.
One of the honors of my lifetime has been to become your friend.
Oh,
and
well, I feel the same way.
I still remember when we first met. What struck me was how much time you give everybody, right? You really focus on those relationships. You do make yourself so available for folks.
I try. Well, at least, for good people trying to do good things in the world, whatever I can do to be helpful, I think that's, part of my mission in life.
So Chelsea, you wear so many different hats, right? You impact different communities. You're working in many different lines of work. Obviously, healthcare, public health, global health has been a big focus of the things you've done. When you were younger, childhood, as you mentioned, in Little Rock, in the White House, other points in your life, like what really inspired you to get more involved with healthcare in particular or public health?
I grew up with two parents that were deeply involved in public service. My dad was the governor of Arkansas when I was little. My mom was the chair of the Legal Services Corporation of America, the kind of head of the legal aid organization in the United States. I remember as a little girl, often, on the weekends or after work, she would go to women's shelters and kind of meet with her clients. And she was very, at an age-appropriate level, because I was young, but she was very clear about explaining to me why she did the work that she did, what was so important to her, kind of how she was engaged in the work that she felt called to do, in the same way that my dad would talk to me about kind of what he was doing. And I had a little desk, in his office at the state capitol. And so, sometimes I quite literally went, to work with him, and I would be listening to learn whatever I could about kind of what he might be doing on a given day. And I felt as if I very much had this sort of both ringside seat and also was included, at least in kind of the why of what they were doing. I had always been interested in healthcare. I remember asking, my doctor so many questions when I was little, whenever I was kind of getting a routine immunization, or if I was at just a general well child visit where maybe that wasn't on schedule, or I was sick and I'd have to go to the doctor. I had my tonsils taken out as a kid. And I remember being completely fascinated by having to be in the hospital. I think my poor parents were a little bit perplexed as to why I was like, this is so cool. And they're like, we just want you to come home safe and sound. And I also was always really interested in science, really interested in everything from kind of understanding kind of what was kind of in the earth and in the skies and kind of everything in between and beyond. I do, though, have a real seminal memory, which I've talked about before, when I got interested in public health, although I couldn't have used those words because I don't think I knew that nomenclature at the time. And it was in November of 1991, and my dad had recently announced his candidacy for president, and I was in his campaign headquarters, and the nightly news was on. This was back in the era where at least everyone I knew watched the nightly news. Often have an early dinner and watch the nightly news, or maybe watch the nightly news while making dinner, and then you would sit down at the dinner table and talk about the news. And the nightly news was on, and one of, if not the lead story on all the major broadcasts was Magic Johnson disclosing his HIV status. And the ways in which the commentators spoke about this and framed it, at least as I remember, was very much kind of through the prism of courage. Oh, it took so much courage for him to do this. Wow, how brave he is. What a hero to talk about this at this moment in time. And I remember thinking, like, why does something about your health require bravery?
Yeah.
Like, why is courage necessary if you're just talking about
the stigma, right?
something about your health? And so that got me really interested in HIV specifically, and got me really interested in stigma, got me really interested in kind of the science and kind of the, at the time, certainly like rather rapid research and thankfully, like fruitfully so, kind of understanding of HIV, and then the development of antiretrovirals. And so I got really interested in all of this, and I remain interested in all of this, 3 decades plus later.
Wow. So you, prior to that Magic Johnson experience, you weren't particularly saying, hey, I'm going to go into a public health field.
I mean, I was in elementary school, so I was like,
yeah,
I don't know. Like, I remember for a while, I was like very interested in satellites, and I was like, I'm going to build satellites. And for a while, like I really was obsessed with my pediatricians. For a while, I was like, I'm going to be a pediatrician. And then when my grandfather sadly passed away of a stroke, the first year that we lived in the White House, sadly, I lost both my mother's father and my father's mother. My grandfather, whom I called Pop, died of a stroke, and my grandmother died of breast cancer. And I remember when my grandfather was in the hospital after a stroke and before he passed away, for a while thinking like, oh my gosh, these doctors who work with the heart are just amazing, and they're explaining all these things to me about my Pop's health, and maybe I want to do that. So I was always kind of drawn toward trying to better understand the world around us, or the world above us, trying to better understand, our bodies, try to better understand the systems, or maybe the misnomer that we use systems like around not only healthcare, but kind of anything that could be related to public health. But I can't, I don't deserve any credit for being like, 11 years old and thinking like, grow up one day and we're going to work in an organization that is going to try to get HIV treatment to everyone everywhere. I wish that I could.
I thought you had it figured out.
Have had that clarity. No, my crystal ball was not anything but probably very cloudy.
Yeah. A lot changes too once you have kids, right? I know for me personally, even as a pediatric surgeon, I mean, once I had kids, it kind of changed a lot of my outlook on medicine, actually. Even the way I practice and some of the things that I cared about more broadly kind of shift a little bit. How did that change for you once you had your kids?
I think that for me, my daughter is now 11, and I remember so vividly when she was born, not too terribly far from where we're sitting today. And it really was a visceral experience. I also had been in labor for a long time. And so I'm sure that part of this is due to just exhaustion and anticipation and excitement. But I really remember saying to my husband, like in the delivery room, if the Vikings come, I'm going to defend her, because we've been watching like some show on the History Channel. And he was like, we are in the middle of New York City. It is 2014. Like, the Vikings are not coming. I was like, but I'm going to be ready if they do. And he was like, okay. Like clutching her to my chest. I'm like, nothing's going to get through me. And I don't think that feeling's ever gone away.
Yeah.
That primal sense of not ever having, I'm not a poet, but like not having ever known a love that intense or all-consuming, not ever believing that I really could, like, not only proverbally, but actually like run through a wall if I had to protect my child and now children. I also think more directly to your question, becoming a parent intensified what I already cared about.
Mm-hmm.
I don't think it
True.
brought kind of new cares really kind of into kind of my aperture of focus or intentionality. It just made everything that much sharper. So kind of the work that we're doing, in early education just felt all that much more urgent. The work that we do in global health around the world felt just all that much more weighty. And the teaching I've done or the writing I've done just all of a sudden took on also this different sense of responsibility.
Mm-hmm. Mm-hmm.
I guess. Yeah.
That's a good, that's a much better way to word it, right? It and it changes your perspective on the issues you care about a little bit.
Well, I think it at least for me, I don't know if it changed my perspective so much as it gave more substance to my perspective, meaning that, certainly, I think I've always believed it's important to both kind of do what you can in the here and now and simultaneously, build for a better, healthier, more equitable, more just, more sustainable, future. I think you have to operate on both time horizons. I think though, the longer duration time horizon just all of a sudden had more substance because there's a sense of, oh my gosh, like this really is like, our children will inherit the future is like a beautiful song. And also all of a sudden like, oh my gosh, then our children are going to like, inherit the consequences of whatever we do or don't do today. One thing that I will say, maybe this is an area where I changed a bit actually, is I lost all patience for, if I had ever had patience for the like, oh, the young people are going to save us.
Yeah.
I'm like, well, what are we doing?
Yeah.
Like,
True.
what are the adults doing? Like that, I don't know if I'd ever really, I don't know if I had agreed with that or spent time thinking about that before. I don't remember, but all of a sudden I just had no space for that. Like, no, like that's then like exonerating our responsibility for what we need to be doing to try to help stop bad things from happening, help good things to happen. We shouldn't give ourselves permission to check out. We should do what we believe is important and urgent today so that our kids don't have to save us. I would like for my children to not have to save us. I would like for your children to not have to save us.
Yeah, we have that responsibility. You're absolutely right. So, when you and I talk about this often, issues that we've worked on together, gun violence, prevention, maternal mortality, improving access to care. There's a lot of challenges in our current healthcare system. I think yourself, Clinton Global, it's been impressive. And I do want to talk about some of the major achievements you guys have had across global health. I know I heard at your latest conference as well, when it comes to HIV drugs, and beyond, really incredible coalitions you've built. Maybe we'll start there, actually.
Sure.
What are some of the, let's say in the last 5 to 10 years, some of the biggest things that you think have come out of CGI?
Well, I'll talk about, bringing it kind of all together because you just mentioned both trying to help protect people and treat people with HIV and CGI. I'm incredibly proud at, our last meeting in September, the announcement between the Clinton Health Access Initiative, Gilead, the Global Fund, Dr. Reddy's Laboratory, the big generic manufacturer in India, and other partners on really kind of the first of its kind ever, kind of a meaningful simultaneous launch in both places like the United States and Europe and the Global South, particularly across Sub-Saharan Africa, of a new anything in healthcare. In this instance, really the closest thing that we've ever had to HIV vaccine, something called lenacapavir, which is a twice-a-year injection that in trials in South Africa, provided perfect protection against HIV infection in young women 16 to 24, and then in other populations. And incredibly grateful to Daniel Day and the Gilead team, and incredibly grateful and proud of our Clinton Health Access Initiative team, who really started working together many months even before Gilead had received final FDA approval to understand kind of what it would take, what would be required from Gilead and from generic manufacturers to be able to basically, hit go, to use a simplified heuristic. Kind of once there had been FDA approval. And so initially, like, Gilead is offering, a $40 per person per price a year from its own branded lenacapavir. But we believe, in 12 to 18 months from where we're talking today, there will be similarly priced generic lenacapavir rapidly to scale up across low and middle income countries. I'm incredibly proud of this. That
Huge.
was like a 90-second, if that, description of something that took many months and many people's time and energy, and really just, again, none of this would have been possible if Gilead weren't willing to kind of think about their business in a different way, and kind of think about the market in a different way, and think about their both opportunity and responsibility in a different way. And so I certainly hope that not only will they follow kind of this paradigm in the future for other new breakthroughs that have just enormous capacity to save lives and livelihoods and protect communities. I hope other pharma and medical device companies will do the same.
We'll do the same. Let's just drill down on that. So how did they think about their business in a different way? Can you speak a little bit about that?
Sure. I mean, the list price here in the United States is substantially higher as it is in Canada and Europe and elsewhere. And I think that as Daniel O'Day said at the Clinton Global Initiative meeting in September and in interviews as well, that there really was this understanding that they believed that kind of what the market would accept in the global north would more than compensate for effectively the absence of margin, shall we say, of the kind of 2 million guaranteed doses at least of the $40 per person per year price in the global south. I also think, Chethan, it was the shorter duration, right, of the kind of rapid scale up of generic capacity, initially with 6 key partners and possibly with more over time. And so I think that time-bounded nature of the agreement also probably made it more attractive than were it to be open-ended.
Got it. Yeah, these innovative models are super timely. I mean, there's so much conversation right now on drug pricing, right? Are you optimistic about our ability domestically, you think, to be able to eventually lower those drug prices for Americans?
I mean, I'm optimistic in that certainly we're now having a much more kind of broad-based and bold conversation, I think, than we've historically had. I think also, in a moment where we seem to have very little bipartisan agreement or even kind of nonpartisan kind of recognition, there is wide bipartisan agreement, in Washington and I think also, across the country in the real imperative to lower drug prices for patients first and foremost, and also for kind of other parts of the system. I mean, we see what's happened in many states, right? I mean, Colorado most notably, but not only Colorado, where there have been efforts at the state level to kind of force price caps or have kind of state mechanisms to that are not kind of price caps, but other state mechanisms to effectively lower at least the burden to patients. And so this, both the different things that are being discussed, the different executive orders out of the Trump White House in Washington, but also what's happening around the country says to me that there's I hope, like stickiness here that persists beyond whatever may happen in the elections in November or whatever may happen in the next presidential election. My hope, though, is that there's even kind of broader experimentation, right? That Medicare and Medicaid are given even more authority to effectively use their purchasing power. That the VA, which already has actually, I think, more substantial latitude than many people realize, is given even more. That the DoD through TRICARE also is kind of given more permission, and that kind of the full weight of the American government, which does effectively act as an ultimate payer for the majority of Americans, really uses that negotiating leverage in a way that President Trump has nodded to, but not yet, I think, had run full bore toward. We have to do a much better job of educating, women, communities broadly, around the real dangers of opioid use and other substance use addiction disorders in pregnancy and postpartum. So we know so much about what needs to happen, and we also have to continue to be candid that abortion bans are harmful.
Yes.
They are harmful. They are harmful to patients. We now have painful real-world evidence of that with women who died in Texas and Georgia because they did not receive the care that their healthcare providers knew that they needed, and also deeply damaging to healthcare providers.
So we're at a very interesting time in this country, of course, and I'm sure you've probably felt this happen every 2 to 3 years, right? These cycles and a lot of kind of competing headwinds. But to be real, I mean, public health, when it comes to trust in public health, it's of course, trust has been eroded. Misinformation, arguably at an all-time high. What do you think, as a field of public health in the past, that we've done well and that we could improve on going forward?
Oh gosh, Chethan, that's certainly a very large.
It's a big question.
It's a big question.
It took us 2 hours.
Yeah, I think, I think, thankfully there's been a lot of really good research done on trying to understand and give real contour to why so many Americans are skeptical about healthcare. For some, certainly, I think it is deep mistrust, and for others, it's just this sense of is my doctor really looking out for my best interests? Like, is this hospital really going to take care of me? I think it's important to understand that what we often kind of frame as one heuristic has lots of different kind of pockets underneath it, and we know that many people have both felt and have in actuality not been served well by kind of their interactions with the healthcare system, whether that's an individual doctor, a clinic, a hospital, an insurance company. That many women know that our experience is often discounted. There's a lot of evidence to back that up, whether it's around how we report pain or kind of the seriousness with which our questions are treated, juxtaposed to the kind of way in which a man is often responded to by a healthcare provider. We see this, further exacerbated, for Black and brown women. We know that for rural communities, as we were talking before, this conversation began, that often there's not a real appreciation as they experience it for how hard it is for them to get to an appointment, to actually kind of seek care that they know that they need, or that maybe a doctor has recommended. So I think we often have this conversation kind of through the fulcrum of vaccines, which is something I care deeply about, and it has been it's very painful to see what's been happening certainly with measles in South Carolina, but also now we have a measles outbreak in the largest ICE detention center in Texas.
Wow.
Which is really concerning. And certainly, you have measles cases all over the country. And I think that is a vitally important conversation to really understand that many of the people who have been kind of pushing, mis and disinformation purposefully often actually do have quite deep profit motives to do that, because they're simultaneously kind of selling you a newsletter or maybe, a non-FDA regulated supplement that, they're promising will take the place of the vaccine and provide adequate protection from infection or help you magically kind of get better if you are infected. I think that is a really serious and important conversation of, how do we ensure that we're rebuilding trust with families? Also, really doing a better job of supporting pediatricians who are on the front lines having these conversations, or pediatric nurses, school nurses, really doing a better job of supporting our frontline workers who are having conversations with parents, often who are understandably questioning, like, why does my child need this specific intervention? That is, I think, though, two separate groups. Vaccine questioning or skeptical or curious, parents, or maybe, adolescents and kids themselves, versus the kind of, I think, really either ideologically or profit-driven kind of anti-vaccine crowd, painfully many of whom are now in positions of power in this administration. That, though, I think, after like a 2-minute, sidestep, that I think is a really important conversation. But I think it's also important that we don't think that conversation is synonymous with a conversation about trust in healthcare, because I think there are many reasons why many people feel often at best that they just haven't been fully seen or fully heard. And Chethan, you ask, like, well, what do I think we've done well? I do think that we have gotten progressively better about having these candid conversations, about trying to understand how to better meet patients where they are, having a more community-based approach, having more of an intentional focus on rural communities, having a more intentional focus on populations who historically have been, as we now kind of refer to it, I think appropriately in public health, underserved. And also, I think we still have just so much more work to do. And some of that work, I think, is in how we have these conversations, and also who we're centering and who we're listening to. I think some of the work has to be, how we're training like the next generation. I was
just going to say that.
Of like doctors and nurses, right? It's, I think many medical students will go all the way through medical school and never be taught anything about menopause.
Yeah.
Right? Like that is a stage that, if like we're lucky enough, women will spend decades in. Yeah. And so, I think like there's some big glaring absences. And also we just need more healthcare workers, right? Even if all of the techno optimists, are totally right about all that kind of AI can do, kind of in partnership with healthcare workers, as overseen by healthcare workers, as an extension of healthcare workers, we still don't have enough doctors or nurses or psychiatrists or psychologists or addiction therapy specialists or school nurses, or like we need to do just a better job of building meaningful, high quality, with dignity healthcare training capacity in this country, so that every American everywhere can have access to the type of
good quality care,
the type of quality of care that I know like you and your team provide to your patients.
I couldn't agree more. And it's interesting in the conversation around even vaccines or any of these issues, there's, I want to get your reflections on this statement here, but I don't know if we've done a great job in allowing questioning, right, broadly, and I'll say maybe in the scientific community, questioning of dogma, which I view as different than elevating one random study, putting it at the same level as like 1,000 meta-analyses, which we shouldn't do, right? We have to be evidence-driven. We need to be data-informed. Agree totally on that. But hearing people out, I think is an important skill. And you're right, same comment about menopause, but in medical school, I don't think a lot of us are trained to actually do that as well as we think. And what I mean by that is empathetically, right? Because I find whenever I have conversations with unlikely allies, I do learn something. And there's gonna be a tremendous amount I disagree with. And we're gonna have to agree to disagree. I'm not gonna change a mind, but I do learn something from why that person has a grievance, why put myself in that person's shoes. And that helps to inform our policy. And I think that's kind of a critical skill that our future healthcare workers also need to learn.
Oh, I completely agree. And I think, again, you have to do, I think just generally, any of us who have, any platform, always, I think, have to do a better job of asking ourselves and being candid, what do we know? What do we not know? What perspectives or biases are we bringing in to any conversation? Having the humility to listen. And I think, Chethan, you said it incredibly well. It is, I think, it is vitally important in this moment to not have false equivalencies.
Yes.
I think that is hugely important, and I worry sometimes out of like the most wonderful human instinct to be empathetic, we lose important perspective. I think that is not healthy.
Yeah.
I think it is important to have real candor and commitment, but not dogma to what, because science inherently is non-dogmatic, right? I mean, the whole scientific kind of enterprise is one that is inherently both optimistic and skeptical, and not ideological or dogmatic. And so I certainly agree that we always have to find common ground when it exists, and also just be very clear to not be fudgy or fuzzy about what the evidence says.
Absolutely.
Like the evidence is very clear on vaccines. The evidence is very clear about the vaccine schedule we had from the CDC until quite recently, and the one that thankfully the American Academy of Pediatrics and others is standing stalwart behind. That to me though is different than creating, of course, the capacity to listen to parents' questions and training doctors about how best to do that, and telling patients, of course, you can always come back with more questions, but then also we need a system that not only supports all of healthcare professionals in being trained that way, but gives you the time and the space
to do that.
Right? And right now, none of that is true.
Yeah. I think you said that beautifully. Can't paint any group with a broad brush, right? I agree with you. If someone is against, or if they're a vaccine skeptic, there might be other people in a coalition that they're affiliated with that are pro-vaccines, but maybe are for, let's say, some element of NIH reform or better food standards. We've talked a little bit about that before. And I think you only know that when having those conversations.
I mean, Chethan, we've been working, the Clinton Foundation's worked with the American Heart Association for more than 20 years through the Alliance for a Healthier Generation to advocate for better school food standards. So I'm thrilled that more people are paying attention to this. But last I checked, the Trump administration was cutting back on SNAP benefits, not providing more funding to the U.S. Department of Agriculture or the Department of Education. In fact, they are dramatically cutting the DOE and threatening to entirely eliminate the DOE. Why does that matter in this conversation? Well, the USDA, effectively, provides the funding for, a lot of what kids consume in schools. Free breakfast, if that's something that either your entire kind of school or school district has determined is important, or if that's kind of what your family qualifies for, is a major contributor to school lunches. The DOE is for many years either not or has, depending on kind of what year, provided additional funding to schools for nutritional and health education. So while I appreciate that certain members of this administration talk a lot about school lunches, they're not putting any dollars toward it. In fact, they're taking dollars away from it. But I'm thrilled that what I think, in a silly way for too long was seen as like a Democratic issue. I mean, Mrs. Obama was excoriated, right? Like the school lunch marm for wanting there to be healthier standards. Now that we have, Republicans and others that are part of this conversation, I hope that it can be, a nonpartisan one. I can't take them seriously though, when they're standing shoulder by shoulder with people that are making it substantially harder for school districts and low-income families to actually access healthy food. I just don't believe them.
Well, that's the point even on the healthcare side, right? For payment models and so on. I mean, we can innovate all day long and we can make things more efficient, but if that funding isn't there, if people aren't getting that access, then it doesn't matter. So I think that's an awesome point. So maybe at a more macro level, right, for listeners to really understand, what do you think are some of our most pressing, let's say 2 or 3 of our most pressing public health issues that we need to really kind of try to tackle in the next 5 to 10 years?
I think...
Because we talked about things like social media, we talked about maternal mortality.
I certainly think, ensuring that every parent, as well as every child and every adolescent, really understands the incredible power of vaccination to keep themselves and their community safe is a real imperative. I find it deeply troubling, not only with how many measles cases we have, that we had infants die of whooping cough last year, and that we have current leadership in this administration talking about also possibly getting rid of a recommendation on things like polio. So I think we have to work very hard to continue to advocate at a policy level for the policies that we know, because we now have decades of evidence, really help keep kids and communities safe from vaccine preventable diseases, and also continue to support frontline healthcare workers who are having these conversations, and support public health communicators like you, Chethan, and others who are trying to bring real evidence-based with empathy, but real very clear evidence-based information into conversations that that parents are having. I certainly, yes, I mean, we've talked about a maternal health mortality crisis, here in New York City, and also around the country. I think we similarly have a lot of evidence around what really works from a kind of early intervention standpoint, from a practice standpoint, and we're not doing enough to turn that evidence into action, whether that's ensuring that every woman has access to a doula, that every woman actually has access to high quality, consistent prenatal care, that every new mother has kind of access to high quality postpartum care, that we're doing rigorous postpartum depression screenings, that we're doing a much better job of kind of interrupting and then removing the threat of intimate partner violence. We have to do a much better job of educating women, the communities broadly, around the real dangers of opioid use and other substance use addiction disorders in pregnancy and postpartum. So we know so much about what needs to happen, and we also have to continue to be candid that abortion bans are harmful. They are harmful. They are harmful to patients. We now have painful real world evidence of that with women who've died in Texas and Georgia because they did not receive the care that their healthcare providers knew that they needed, and also deeply damaging to healthcare providers and to kind of the mental health and well-being of our healthcare providers. So I think we know so much about what works, but again, we're just not doing it with enough kind of attention, focus, or coordination, I would say. I certainly, am following what's happening in Australia with the social media bans for kids under 16 that went into effect in December. Thankfully, led by Governor Hochul here in New York, the bell-to-bell bans of kids, not being able to access phones during school, and certainly hope that the hypotheses that these will help kids be more present in their lives, more connected to their friends, to have healthier connections to their friends and their families. I hope that the evidence bears that out, and certainly think then we'll have to rapidly continue to advocate for those policies elsewhere if the evidence does. And I would say, though, too, one of the things that I'm very worried about here is our defunding of science. And the cuts not only to National Science Foundation funding and NIH funding on everything from women's health to brain health to cardiac health. I'm also worried about the cuts to the NASA research budget, to the National Forestry research budget, to the U.S. Ecological Survey, to the EPA research budgets, and just all that then we're not learning about what can help us stay healthier, get healthier, or be healthier, and to hopefully all have the chance to thrive for many years and decades to come.
Lots of work. Lots of work ahead. So Chelsea, just one final question. I know we're a little bit over time. I learned maybe a few years ago that you are also the head of a venture fund, right? Metrodora. I just wanted a quick comment on that. I mean, What made you want to get involved in that space? You do fund some incredible companies and
So, I
startups.
mean, a fund that I started with a friend who had been an investor for a long time, who, as through her own patient experience, I think as is true for many people, was like, why was this so hard? Why was it so hard to get a diagnosis? Why was it so hard to navigate? It shouldn't be this difficult. And so kind of with her kind of investor experience and acumen and network and, just the sense of, I kept meeting a lot of great people who were doing hopefully great things in healthcare, but had no kind of way to really in a meaningful and sustained way, support them. Have just, so enjoyed over the last, I guess now 6 years, meeting hundreds and hundreds of people who are fundamentally optimistic, who believe that things can and should be different. And we've invested in, a lot of amazing, particularly female founders, which has been, I think, important to us. Doing things in women's health or pediatrics, and a lot of great founders, men and women alike, who are trying to solve often what I think of as like the unsexy, but important stuff. Of like, which we were talking about earlier, a lot of, the logistical challenges in healthcare, to ensure that hopefully, people like you have more time to actually do the work that called you to this profession in the first place.
No, I'm amazed at some of the startups you have funded, social care networks, access to pediatric care, care navigation. These are all, at times those unsexy issues that others might not want to take on. But we could spend a whole hour probably talking about how you thought about ROI and stuff.
And importantly, we funded a lot of founders, who really are committed to working in and with Medicaid. And proving that you can build great businesses that deliver, really better quality of care experiences with better quality of outcomes that can be sustainable, as enterprises over time. And I think that's really important, particularly now.
Well, Chelsea, thank you so much for all the time.
Thanks for having me.
So I really, really appreciate it. Thank you.
Thank you.